My producer does this to me every Saturday just to see if I'm paying attention. I always enjoy coming to Arkansas because when I'm on the radio in Oklahoma, I always tell them I'm an Arkansas girl in an Oklahoma world, because you never forget where you came from. And I've been affiliated with the Broyles Foundation now for about 10 years. But as everybody in Arkansas knew, we all knew who Coach Broyles was. So it's an honor today to talk about Medicare. I got a question. When was the last time the government sent you an easy to check off list that says, here's how you do this? You're laughing. Did you not get your book in the mail? Oh my gosh. Okay. Well, what we're going to talk about today is Medicare. Medicare is government health insurance. It's not an entitlement. It's government health insurance. If you worked, every paycheck that you got from your employer, or if you were self-employed, you paid Medicare taxes. Medicare started in 1967. And it started out, and for many, many years, it was A and B. Everybody that was on Medicare had a Medicare card, and it was A and B, so it was pretty easy to understand. And let's start with the first parts of Medicare, because right now, if you get information, and everybody that's on Medicare, and I'm fixing to lose this, is, you're getting a lot of mail right now. I'm trying to fix this. It's like getting dressed in the morning. That was fun. Okay. But Medicare is totally acronyms. It's A, B, C, and D. And then, if you're on Original Medicare, you get your Medicare guide, and on page 70, it shows you there's some more acronyms. Those are supplements. But let's start with the basics of Medicare. And everybody that's in here today, I don't know about you, if you hear somebody talking, you'll kind of think the next day, now what did they say? What did they say? So I like to play school when I do Medicare. So on your little sheets, if you'll notice, right at the top, there's two ways you can take Medicare benefits. Let's start with that first. So here we go again. We're into acronyms. So the first way you can take your Medicare benefits, and this is for anyone that's over 65, or if you're under 65 and you've qualified for Medicare disability, you can also have A and B of Medicare. But the first way is Medicare A and B, that's hospital, medical, and if you go that route, you will have a supplement, which also is the acronyms, and then you will have a Part D. Now, Part D will be the drug plans, and I will go into detail on those on the second page. So that's the first way you can take your Medicare benefits. The other way is you can opt in to a Part C. So on that second line, just write down Part C. The Medicare programs call those Medicare Advantage plans, okay? Medicare Advantage plans. In our area up here in northwestern Arkansas, we have Humana, Cigna, Aetna. United Healthcare has a program up here. I think there's about 11 different Medicare Advantage options. So those are the two ways that you can take Medicare. Now, if you're on A and B, that's your hospital and your medical benefit, and a supplement and a drug plan, you will have 3 ID cards. You'll have a Medicare card, whoever your supplement is with, and who your drug plan is with. So you'll have 3 ID cards. If you're on the other option, the Part C, you'll have 1 ID card, and in the back of the Medicare guides, you will notice that Medicare calls those Medicare health plans, but they are Medicare Advantage plans. When you opt into a Medicare Advantage plan, you have to have A and B of Medicare, okay? But you do not use your Medicare card when you go to your providers, okay? I see some heads nodding. You had experience with Medicare Advantage? A little bit. Okay, we'll talk about that in a little bit. Okay, so 2 ways to take your Medicare. You can have Original Medicare, which is the largest PPO in the nation. You're covered if you're in California, Texas, Arkansas, New York, wherever you are. Original Medicare is not a regional. The Part C plans, if you opt in to Part C, your service can be provided in the area where you live, okay? And some of the Part C plans are HMOs. Those are definitely in the region where you live, and some of them have PPOs. So let's move on down on the sheet and start with the 4 parts of Medicare. The first part of Medicare is hospital benefits. You don't pay an extra premium for that. The way that part of the Medicare program works is all the years that you worked, remember your employer paid Medicare taxes. You also paid Medicare taxes. It's a 50-50 split. So part was taken out of your check to pay for Medicare, and your employer matched that. You don't pay an additional premium. If you're on Original Medicare, you can use any provider in the United States that agrees or has a contract with Medicare. And I oftentimes use the example, if you live in Fayetteville and you have stage 4 cancer, and your doctor says, well, my buddy is down at, MD Anderson, you can go. Because you're on Original Medicare, you have a supplement. You can go anywhere. And the Original Medicare in Part A pays for hospital, home health, hospice, and skilled nursing. And I know Tim kind of touched on the skilled nursing. That's rehab therapy. It's not long-term care coverage. It's rehab therapy. So if you went into rehab therapy on Original Medicare, the first 20 days are covered. The rule is you have to show a daily improvement for Medicare to pay for that. So the first 20 days, it does not cost you an out-of-pocket. If you are in longer than 20 days, Medicare will approve up to 100 days in a SNF unit. And again, that's for rehab therapy. The cost, if you did not have a supplement, would run $167 a day for that service, and Medicare picks up the other part. Original Medicare pays for a private room and 3 hours a day of physical therapy. And you need to write that down because that is important information. The Part B Medicare is medical insurance. That's when you go to the doctor's office, when you have outpatient surgery. If you go in for an MRI, a CT, have blood drawn, that is billed through Part B Medicare. And again, if you're on Original Medicare, you can use any provider in the nation that has a contract with Medicare. Medicare pays 80%, and if you're on a supplement, it will pick up the 20%. Now, the changes that all of the insurance companies are mailing to people right now, they're saying, watch out, Plan F's going away, you can't have this, you can't have this. What the insurance companies are talking about, and I refer back to page 70 on your Medicare guide, and everybody that's on Medicare should have gotten their current book. It says Medicare and You 2020. On page 70, it gives you the breakdown of the Medicare supplements. They start with A, and they go through N, And the Plan F may have an asterisk on it. Anyone that was born from 1954 prior can always get a Plan F. And Plan F is a Medicare supplement. And here you go again. I refer back to page 70 in your Medicare guide because it breaks down the standardized plans for Medicare, the A through N. If your birthday is in 1955 and the newer aging in people to Medicare, those people can no longer get what is called a Plan F. But I will tell you from a professional background, I have always enrolled my clients in the Plan G more than the Plan F because they are exactly the same coverage. Plan F and Plan G are the same coverage. The only difference between Plan G and Plan F is you have a calendar year deductible on the Plan G, and right now that deductible is $185. Well, to a lot of people that are aging in to Medicare right now, and they're coming off of the Affordable Care or maybe group insurance, their deductibles in co-insurance have been much more than $185. So it makes good sense for the client. I always give them the option because it's your coverage, not mine. But Plan G is an excellent benefit. In Arkansas, if you go on Medicare disability, Arkansas does not have the rule with insurance companies that they have to offer you a supplement. In Oklahoma, they do. So right now, people that are on disability, if you're with a spouse and your spouse has group coverage, I would always advise people on disability to stay with their group coverage because it's going to be more comprehensive than if you went on a Medicare Advantage, because right now that's what's available for most people that are on disability Medicare in Arkansas. And that's anyone that has worked 40 quarters, applies for disability. You have to be on Social Security disability for 2 years before your Medicare will start. And it's very critical for people when they go on Social Security disability. You have that open enrollment when you get your Medicare card. So let's just say someone has received their award letter from Social Security and it says your Medicare will start February the 1st. That person needs to act if they are going to apply for a Medicare Advantage plan. They need to act very quickly, or they need to make a decision if they're going to stay on the group. Because here's the rule on Medicare. If your spouse is with an employer and that employer has more than 20 employees, the group will be primary, and they do not have to enroll in Part B. And it would save that person on disability about $135 a month. But that only applies if the person on disability has group coverage with their spouse. And the rule is if they have over 20 employees, then they can stay on the group insurance. Now, what happens if that spouse loses their job, say in a couple of years, and that person is still on Medicare? They will have, that person on disability will have a special enrollment where they can apply for Part B. There are 2 forms that they have to fill out from the Centers of Medicare Services, and anybody can pull this off of the website. And those forms are, if you want to write them down, is CMS L564 or CMS 40B. And what those forms would do is the employer would fill out one form showing that the person has credible coverage where they didn't have a gap, and the other form, the CMS 40B, would be the beneficiary's request to enroll in Part B with no penalty. And the same thing applies if you're working past 65. we get more and more people in our office now that are continuing to work, they're healthy, they like what they do, so they have the opportunity to stay on their group. And I'm thinking of major groups up here in northwestern Arkansas. We've got Tyson, we've got Walmart. They've got a lot of employees that were definitely born before 1954, and they've decided to continue working. And because I get their phone calls, and they've decided maybe, well, I'm 70 now, I'm going to retire, but I heard I'm going to have a penalty. So I sound like a person that works for Social Security a lot, because those are the two forms that anyone that has been on group insurance, that they need to complete those to make sure that they don't ever have a penalty. And by the way, when you complete those forms, you always keep a copy. You keep a copy, and when you take them to be processed, because you're going to have to take them to Social Security to get them processed, I always tell my clients, get your form stamped, because Social Security will stamp the form the day you come in, and that is your proof that you've completed that. And the best time to go to Social Security is Monday, Tuesday, Thursday, or Friday at 3 o'clock, because they close at 4. They will get you out. If you show up on Wednesday, you show up at 11 because they close at noon. And why do I mention Social Security? And this is what's confusing to people. If you're new to Medicare and you're not drawing a Social Security check, you need to set up a Social Security account. You go to socialsecurity.gov and set up your personal account, and you enroll in A and B of Medicare. Now back up again. You only enroll in A and B of Medicare if you're not on group insurance, okay? And you need to do that within 3 months before your birthday month. So if your birthday is in November, you would count back 3 months, and you would make sure that you do that enrollment before your birthday month. If you delay it and you forget, you get busy and you jump on the website, your birthday's in November, and you wake up in January and say, oh, well, I'm still okay because Medicare says you can enroll in your birthday month 3 months before or 3 months after. If you enroll any month after your birthday month, you're going to push your enrollment time period out about 6 months. So I always advise people, if your birthday is in 1955, or if you know people that are turning 65 next year, they're not drawing their Social Security check, they need to become very familiar with the socialsecurity.gov, set up their account. And if you're not computer savvy, when do you go to Social Security? You're listening. And I'll tell you who told me that. I have the public affairs specialist that on my radio show a couple of times, about 6 times a year. He is from Social Security, and that's what he told me. He said, hey, you want to get in and out? You show up at 3 o'clock. And I said, I'll pass the word along to everybody I know. So every time I have an opportunity, that's just a tip. Doesn't matter. If you want to go to Social Security, they're your employees, okay? So show up, but you don't have to wait all day. I hear chuckles. Moving on to the second page, Part C of Medicare. This started about 12 years ago. They used to be called Medicare Select. Now they are called Medicare Advantage plans. If you select a Medicare Advantage plan, and it's an HMO, our rule is your doctor has to be in the network. We have to make sure that your prescription drugs match that plan. Now, how can I figure that out? The government has a very good tool. It's called the Medicare Plan Finder, and the website for that is Medicare medicare.gov. What we do for our clients in our office is we will do a personal search for our clients that have their medications in there. And if our client wants to look at a Medicare Advantage plan, I'm looking at the carrier. I am checking to make sure that their doctor is in the network, that the hospital they want to go to is in the network. If you are on a Medicare Advantage plan and you need rehab therapy, you do not have to be in a hospital 3 days to qualify for that. You can be in the hospital 1 day or 2 days. They can move you into a rehab community or a skilled nursing. But on a Part C, you will get a semi-private room and you will get 1 hour a day of physical therapy. All of the Medicare Advantage plans, their language says they will pay the same as Medicare, but not the same amount. So if you go to presentations and the person is there from Humana, United Healthcare, Aetna, Cigna, whoever they're representing, they're only going to talk to you about what is on their presentation. And that's the rule with Medicare, because God forbid we confuse you and tell you the whole story, okay? So the rule is they will pay the same as Medicare, just not the same amount. Most of the Medicare Advantage plans that are in this area, they will cover skilled nursing for the first 20 days. Some cover it just for 5. And then say if they cover it for 20 days, then the 21st through the 49th day, your out-of-pocket would be $160. Most of the Medicare Advantage plans in northwestern Arkansas has on their outline of coverage that your catastrophic out-of-pocket could be anywhere from $5,900 to $10,000. So look at those, because that says if you had a major health occurrence and you're on a Medicare Advantage, that could be your out-of-pocket. So I always tell people that really want to look at Medicare Advantage, yes, you get a smaller premium, but you pay for it as you go, and you need to make sure that your providers are in the list. And in my area, I give them a check-off of the skilled nursing that I know that have the contract, because I'm not about just sell you today, because I want to make sure that if you select a plan for Medicare, that you know where you're going and you have the freedom of choice. And those are very, very important for the Medicare Advantage plans. Most of your Medicare Advantage plans, like I say, you'll have one ID card. They do have silver sneakers, which I like the gym membership, but look at everything you're getting. And I'm from the old school, and I tell people all the time, your health insurance is not worth a dime until you have to use it. So always ask questions and make sure that if you sign a contract for a Medicare Advantage plan, that you know the coverage that you're getting. Now, if you're new to Medicare, or if you've been on Medicare for a while and you sign up for a Medicare Advantage plan, say for 2020, and it's your first time in a Medicare Advantage plan, you have the right to go back to original Medicare. If you get in and say it's June and you're going, this is not what I thought it was, I want to go back to original Medicare, you can do that. It's a matter of just enrolling in a drug plan and finding a supplement, or if you were on a supplement before you signed up for the Medicare Advantage plan, that carrier that you were on previously has to take you back. Did y'all get that?
Is that without medical scrutiny?
Right. If you
Pass that 2-page test or what?
right. And that's if you've been on Medicare, okay? But if you're new to Medicare, you will have to go through underwriting after 6 months, okay? And that's why you just hit a bullet point with me. I could be a pharmatech this time of year. We've run so many Medicare reports for our clients. But when I look at my customers' medication list, I have a conversation with them on choices. And it's real obvious with me if I have a diabetic, if I have an Alzheimer's patient, I'm really going to educate the POA on what the options and their choices are. Okay? That's very important because you do have to health qualify for supplements after you're out of open enrollment. And your open enrollment is your birthday month, 3 months before, and 3 months after. You can pick a supplement of your choice without health underwriting. After that, you have to go through health underwriting. And we have probably 10 different carriers that we use. So we've got some that will take some health issues that are still affordable and give you choice. But good question to ask. The Part D of Medicare, how many of y'all understand that? Oh, come on. I got to have more than two hands. Part D started in 2006. I could do 10 radio shows on this program. Part D is a good deal for people, okay? And as I said, it started in 2006. But the real story that happened to that was when that bill was signed in, Congress gave us Part D for Medicare beneficiaries. I was excited. What Congress gave the pharmaceutical industry was no cap to how much they can raise the cost of your medication. And here it is, 2019. I've watched insulin go from kind of here to, man, it is like through the roof on the cost. I did a shopping the other day for a lady who has a kidney disorder, and she's on an immune suppressant. It used to cost $1,000, which I thought was a lot, and that's a month. And now it's $18,000 a month. So if you want to get on the train and let your senators and your congressmen know that, this could be an issue. We don't have a money tree in our backyard. And when you're retired and we run these prescription reports for people, I just see the cost escalating. And my customers are not winning. So I just say, I send Senator Langford's office, probably his Emily Bruner gets an email a day from me with a copy of some crazy cost on medication. It is a good deal, but you as the consumer, this is the one that you use every month. In your area up here, there are 29 different drug plans that are available for people on Medicare. And we have to learn to be website savvy. Medicare.gov. I'm helping all of my clients sign up a Medicare.gov account. And why am I doing that? Because since this program started in 2006, we have always saved your medication list, and usually the minute, October the 1st, the minute the new plan finder comes up, and the plan finder is the search engine for Medicare that shows if we put, say, if you're taking lisinopril and you're taking Carvedal and you're taking meloxicam, I can put those into Medicare.gov. You have your Medicare number, you have your password, you have your username, and then we click done because now we're going to search and see which drugstore you want to go. And the Medicare Plan Finder will pull us a report, and it will show the drugstore of your choice and where you get the best deal. This is a great search engine, and had we known that Medicare was going to change the rules this year, my agency would have been out in the community a lot and over here in Northwest Arkansas doing training classes for people that are on Medicare. Because last year, during the annual election, we had a little over 500 clients in our office, and the savings to those 500 clients was $1,100,000. That was just 500 Oklahomans. That was over $93,000 a month. And out of the plans that were available last year, it got to be a game in our office. We did not care if we were licensed with them, which means if I enrolled you, I didn't get paid, but you got paid, okay? And when I totaled it up, at the end, actually, I would total it weekly, and I would go, this is crazy. $1,100,000. How many of y'all got that much in the bank? That's a lot of money. And, of course, I'm from the old school, and I'm going, well, Big Pharma wins, but my customers won because we got them on plans that got it down to where it was affordable. Medicare.gov, everybody on Medicare, if you're not computer savvy, get your grandchild over like I do. Have them set you up an account. You need a username. You need a password. Once you set that up, and if you've been on a prescription drug plan in the past, the cool thing about that website is all of the medications that you have purchased on that drug plan will be on that list, and whoever's helping you can just pick the ones that you're actually taking. And then the report can be run. And it's not that hard to learn how to use it. I did volunteer with about 5 different churches when this program first came out, and we had volunteers in the churches that we trained to sit down with their members, because if you got on the wrong plan, or if you just weren't paying attention, or if you were in the hospital, during the annual election and did not make your changes, well, you can't make a change because October the 15th through December the 7th, you're done. And even we can get an extension to file our taxes. But I love the government, and I've made a really good living off of helping people with Medicare. But we've got over 60 million people in America that are on Medicare. We've got from October the 15th through December the 7th, and that's what I call a major, major rush. We are seeing on an average of 33 people in our office a day. That's 11 apiece. And when I come over to volunteer with the Broyles Foundation, the more we can help people and let you know this is not an entitlement. You paid for it, okay? Just like our guys that served in the military and didn't get TRICARE until about 20 years ago. They were promised that in World War II, and finally, 20 years ago, they got it. It's a good benefit, but you have to know how to use your tools, okay? Medicare.gov, username, password. And as of yesterday, in my office, and this started on October the 15th, I've already saved I think I've seen about 30 clients so far, no, 50. I'm at 387,000 just changing people's Part D. And about half of those, I'm not even licensed with a company. It does not matter. It's your money. And if we can help our customers make sure that they get the best benefit and they understand that the difference between preferred and standard drugstores, you win, okay? But I encourage people, check out the Medicare website. If you're on one of those medications that comes up and you're going, now let me look at that figure again. Did that say $6,000? There was an eye drop that was on there yesterday that was $6,900, and I'm going like, really? Really? You need to let your representatives know. Folks in Arkansas are just like they are in Oklahoma. They get it. I mean, you look at that and you look at what you paid last year, and I understand inflation, but that's not inflation. Okay? So, and those are the people, that's their job. Your senators and your congressmen work for you. Okay? And they need to understand that when you're retired, you are on a fixed income, and you need to watch those costs. Because when you're on group insurance, the medication cost, it's fairly affordable. And the VA, if you have VA benefits, they get their medications, it's $8. And, of course, the VA doesn't cover all of the medications, but the veterans do get a good benefit on that. But Medicare Part D, it is a good benefit, but you have to learn how to use the tool. It's critical. Medicare.gov, username, password. Go look at what you're paying for and make sure that you're on the right plan. Okay? Never work with an agent that only works for one company, because they win and you lose. Okay? They only have one game. And I've yet to sit down with a husband and wife and they had the same plan. They may have the same supplement, but the drug plan will be different. The wife will be on one thing, the husband will be on the other. So, rule of thumb is always look at people that are independent, that can give you choices, because bottom line is, that's your money going out the door. And here you go again, the Part D on the prescription. You go to the drugstore every month. That's not, like you go to the hospital occasionally or you have a rehab surgery. But all in all, Medicare is a very good benefit. You just have to learn how to use the tool. I did put some inserts in there on if you are fortunate enough to be single and make over $85,000, you will pay more for Medicare. That's another acronym in Medicare. It's called IRMA. And I've broken it down to the income brackets. If you are a higher income earner, you will pay a higher premium on the Part B and also the Part D. So, Medicare, A, B, C, and D. Then you have supplements, they're A through N. Then you have Medicare Advantages that are Part C. Confused? A little bit? Just jot your questions down. Learn to use the website. We have over here at Rogers at the Senior Center, I know they have a computer class over there. I need to talk to her about coming in and having a class for seniors, just showing them how to shop Medicare Part D, because we used one of the senior centers in Oklahoma City for that. It's a great opportunity. You also have a couple of handouts from me. Little shameless plug for the radio show. If you've got one of these, you can download iHeartMedia. It's 1000 KTOK. I'm on live every Saturday. We only tape if Christmas falls on Saturday. So we try to be live every week. And I think the reason that people tune in is because we talk about stuff. We talk about your life. We bring people in that actually provide those type of services. I'm going to have a guy in next week. He's a Native American, but he provides veterans benefits for the Indian Nation. Well, we'd be speaking German if it wasn't for the Navajos, okay? So that should be an interesting program next week. As always, it's an honor to come over here and work with the Broyles Foundation. We have a lot of customers in Northwest Arkansas. I'm up and down the road. So, do we have any questions? Do you totally understand Medicare? I see a lady in the back. Yes, ma'am? Yes, CHAMP VA, she asked, if you have CHAMP VA, does that work the same as your supplement? Are you a widow of a veteran? Are you a veteran? My husband is 100% disabled. Okay. Number one, okay, your husband's 100% disabled. Okay. CHAMP VA is the same. You do not need other coverage. Now, on the drug plan, if there are some prescriptions that CHAMP VA does not cover, You could apply for a drug plan. We have to put on those enrollments that you do have CHAMP VA, okay? And that would be the only thing you'd have to look at, only if you, had a medication that's not covered. And by the way, if your husband passes away, do not get married. You will lose that. Yeah, you do. You do. I tell my ladies that are married to veterans, you do not, if you outlive your husband, do not get married, because that is a great benefit. Mm-hmm. That's not what I heard from the VA. Right. That's a benefit for widows, okay? Just like their aid and attendance. If you're a widow of a veteran, you can qualify for aid and attendance. If you marry someone else and he's not a veteran, you lose it, okay? That's not in the checkoff book, is it? Okay. Any other questions? To supplements, yes. You have to health qualify. So if you're on a Medicare Advantage plan right now and you want to go back to original Medicare, first thing you do is get the approval from the insurance company, have your prescription drugs, know where you're going on your Part D, and yes, you need to act.
May I say something?
Yes, ma'am.
Eunice is great. I use her myself. I mean, my husband's disabled and on Medicare, so we're going to use a microphone. She's the best. You can call her and she will help you. Even though she lives in Oklahoma City, she's in Arkansas probably every week anyway. But she will help you and she will answer all your questions. That's the great thing about Eunice. And I've given a lot of people her name, and she's just a blessing. I mean, she really is.
And I appreciate that. My oldest son lives in Arkansas, and the game plan is I'm not retiring. I love what I do. So next year, I'm hoping to be in the Fayetteville area at least a week, a month, because we're getting a lot of calls from folks up here that are confused, that, just need someone to sit down with them. And like I say, we have a lot of customers. We appreciate all of our clients, but I want people to understand what you've worked for. And every time I hear television and, I'm not running for office or anything, this is not an entitlement. You paid for it. You paid for your Social Security, okay? Yes, ma'am. You in the red.
Here we go, yeah.
Okay.
One of the cautions that I would tell you on the Advantage plan, and correct me if I'm incorrect, we were fortunate enough that we got to travel quite a bit. If I understand the Advantage plans correctly, if I'm in North Dakota and I need to go to a doctor and they're not in network, then it's out of pocket. Whereas if I go with the Medicare plans, then I can go anywhere in the United States and it's covered if I need to go to a doctor. Is that correct?
That's correct. Now, your first statement was if you were in North Dakota and you wanted to go to a doctor and they're out of network, you can't go unless it's an emergency, okay?
But I can on regular Medicare.
Yes, on regular Medicare, it's the largest PPO in the nation, so you can go. We had a lady in the back.
Mimi, if you are happy with your original Medicare plan and your supplement, do you have to do anything at all? It just should carry over?
You do need to check your drug plan because last year in our market, Humana was one of the most affordable. It was like $14 or $15. That was premium, and I used that a lot for people that didn't take a lot of medications. Well, this year, you had to look at your annual notice that you get from your drug company. This year, the premium's $51.20, so that's a big jump.
Well, so that is another question. We use Silver Scripts. And so my husband had a plan a little different than mine that was more expensive. But we recently got, for this next year, he's going to be the same as mine. It's $23 a month.
Well, it's not, And that's where the premium cost and what are your medications going to cost you. And there you go again, Medicare.gov. You'll have to put your new Medicare number in, set up your account, use your password, and when you get your account set up and you go to the next screen, there's all the medications. And you go, oh, I take that one, and then you just run a report. And the first one that comes back, because when you're in Medicare, like you're on SilverScript, the top carrier will be SilverScript. That means that's the one you're on. Look at what you're going to pay, because it's supposed to be right up there. And there's 3 options in the drop-down box that tell you how to search. One of them is lowest deductible, lowest premium, or lowest premium and lowest deductible. You want to use lowest premium and lowest deductible and just see what populates. You may get another carrier for your drug plan, and you know, if it's substantially less, that's where you need to change.
Right.
Okay?
So far, when I've looked at it, and I do look at what the out-of-pocket expense is going to be.
Don't look at your annual election. Go to Medicare.
Gotcha.
Because you're going to see all of them in there.
Okay.
Okay. That's
right.
where the rubber meets the road.
Gotcha.
Okay.
Thank you.
Yes, sir. My sound guy, he turned me
I
on.
know, oh, hello. Can you talk a little bit about the transition from Medicare supplement or Advantage plans when an elderly person goes to Medicaid? And because you won't have the money, I'm assuming, to pay for the premiums anymore because you don't have the income anymore.
If she is on Medicaid, is this person in the nursing home or just on Medicaid?
Yeah, it's the drawdown. So about to run out of money, file for Medicaid, that kind of thing.
When a person goes on Medicaid and they have Medicare like a supplement, and she's in the state of Arkansas, okay, she can keep $40 a month. Her Social Security check is going to be paid to the nursing home, basically. They will allow her to keep a supplement, and the only reason I would even look at that is, does this person have an MRI? Are they going to have CT scans? Because original Medicare and a supplement will pay for those, and Medicaid, sometimes those are tests that they don't want to cover. So that would be a conversation with the family, because it's not really coming out of her pocket anymore. Medicaid will allow a person in the nursing home to keep a supplement. Okay?
Okay, thanks.
All right. Good questions. Good questions. Yes, ma'am.
Do you do consultations over the phone?
Oh, yeah. I'm driving down the road talking to people. I'm not real good quoting, but yes, and pretty good on email. And this time of the year, my son's in the business with me, Patrick. Patrick and I are both licensed in Arkansas. It's home state. And we have Khoury in the office. So, yes, we do consultations. And, if you've got your Medicare, password and ID set up, I can run that pretty quick and tell you. And from after this Saturday, I will be in the office every Saturday until December the 7th. Okay? So I'm not working on Sunday, though. I'm like Chick-fil-A. I'm taking off. Okay? My favorite place to eat. Again, thank you. And I'm going to close with my favorite quote from one of my favorite guys. There is no substitute for good preparation. And I think our team today has done just a great job. We've got 3 interns here. Where's Quentin? Did he run out? We've got Quentin, Hannah, and Tara, and they've done a great job. They're students at the University of Arkansas, because the Broyles Foundation is not a big foundation. I mean, we're a family foundation, so every dollar that we make goes to help take care of caregivers. And that's our mission. So when we get some awesome interns like this, that's a yay yippee for the home team. And that's why I come over here and work with them, because I know how special the service. And I get a little choked up when I say that because I've actually been boots on the ground a couple of times. And, you know, we're the home team. You know, it's time to catch the ball and go, for sure. But there's no substitute for good quality preparation. Coach Frank Broyles. Thank y'all for coming out today. And we're going to do this again, okay?